Welcome back, everyone, to the Deep Dive.
Mm.
Today, we're going to be looking at something that's, I think, pretty important to everyone, and that is the human side of healthcare,
Uh-huh.
particularly for those with chronic pain. So, you shared some really fascinating excerpts with me from
Yeah.
this book by Brazilian pain expert
Uh-huh.
Fábio Renato Pereira Robles. Um, and I got to say, his perspective is pretty revolutionary.
It is. It's really interesting. He challenges the very foundation of how we define health
Okay.
and well-being. You know, the World Health Organization, they talk about complete biopsychosocial well-being.
Mm.
But Robles argues that this definition just doesn't resonate for those living with chronic conditions.
That's interesting because I think most of us on some
Yes.
level realize that achieving complete well-being all the time
Right.
is pretty unrealistic. Life throws curveballs. Like our experiences are constantly in flux. But somehow,
Yeah.
when it comes to healthcare, we seem to cling to this ideal.
He calls it a myth. And he suggests that we take a more nuanced view of well-being.
Okay.
He views it as a balancing act between contrasting experiences and emotions. And what's really fascinating is how he connects this to the individual's history and their own personal meaning-making. So it's not just about the physical symptoms, it's about how those symptoms fit into the broader context of a person's life.
So instead of aiming for this elusive state of perfect health,
Yeah.
it's more about helping patients find equilibrium within their own unique circumstances.
Precisely. And that's where Robles introduces his idea of the care professional.
Yeah.
He believes that healthcare professionals need to evolve beyond simply treating physical symptoms and become more like guides accompanying patients on their journey toward a more balanced and fulfilling life.
I like that. That's a really good way to put it. And he really emphasizes the limitations of a purely technical approach, doesn't he?
Yep.
It makes me think about how often we hear about people feeling like just a number in the healthcare system, like their individual story isn't really being heard or valued.
Yeah, and he addresses that directly. He talks about how this shift requires deep self-awareness, humility, and a willingness to engage with the patient's emotional and social realities. It's about acknowledging that each patient comes with their own unique history, their own set of beliefs and values, and their own way of experiencing the world.
So it sounds like he's calling for a more human-centered approach to healthcare.
Absolutely.
One that recognizes the whole person rather than just focusing on their diagnosis or symptoms.
Absolutely. And he provides a really concrete example of how this can be put into practice. He highlights the Brazilian Ministry of Health's National Humanization Policy, or PNH. And this policy focuses on providing dignified, ethical, and welcoming care.
Okay, so this PNH sounds great in theory, but what does it actually look like in practice? I mean, how can we as patients advocate for this?
That's a great question. That's a great question. And it's one that Robles really explores in detail. He focuses on the power of observation and the importance of quality time. He uses these terms kairos time, which refers to quality time spent genuinely connecting with the patient, and then chronos time, which is simply chronological time. And Robles argues that care professionals need to prioritize kairos time over chronos time, even if it means challenging the efficiency-driven culture of modern healthcare.
So it's not just about checking boxes and sticking to a rigid schedule.
Exactly.
It's really being present with the patient.
Yeah.
And it seems like something as simple as making eye contact, asking open-ended questions, and really listening to the answers can make a world of difference.
Absolutely. And those seemingly small gestures can go a long way in building trust and creating a more collaborative and effective therapeutic relationship.
Which ultimately leads to better care. Robles then dives deeper into this idea of human connection by exploring the nuances of empathy, sympathy, and compassion.
Yeah.
And I have to admit, this is where I really started to question my own assumptions. I think before reading this, I used those terms almost interchangeably.
It's a common misconception.
Yeah.
It's a common misconception.
I hadn't really grasped the subtle
Yeah.
but important differences between them.
He breaks it down beautifully. He starts with sympathy, which he defines as acknowledging and validating the patient's feelings without necessarily taking personal action.
So you're with them, but not in it with them.
Exactly.
That makes sense. But then what about empathy? Isn't that about putting yourself in the patient's shoes and feeling what they're feeling?
That's the classic definition. But Robles argues that this can actually be counterproductive. He points out that true empathy can be very emotionally exhausting for the caregiver. It can lead to burnout and prevent them from providing effective care in the long run.
So if sympathy isn't quite enough and empathy can backfire, what's the alternative?
That's where compassion comes in, and Robles believes this is the ideal stance for care professionals.
And he defines compassion as
understanding the patient's suffering and context while maintaining healthy boundaries and taking helpful action.
So it's about finding that sweet spot between connecting with the patient's humanity, but also safeguarding your own emotional well-being.
It's a delicate balance. It is.
Being present with their suffering without getting lost in it yourself.
Yes. And Robles argues that cultivating this sense of compassion is essential for creating a healthcare system that truly serves the needs of patients, especially those living with chronic conditions like pain. And this concept of compassion actually ties in really well with this slow medicine movement that you mentioned earlier.
You know, I've heard of the slow food movement, but slow medicine is a new one for me. Could you explain a little bit about what that entails?
It's essentially a reaction to the increasingly fast-paced, technology-driven nature of modern healthcare. The slow medicine movement advocates for a more mindful, patient-centered approach. One that prioritizes quality time with the patient, reduces unnecessary interventions, and really focuses on improving the overall quality of life rather than simply chasing a cure.
So it sounds like it aligns perfectly with Robles' emphasis on Kairos time.
Exactly.
And his critique of the limitations of purely evidence-based practice.
Yeah.
It's almost like saying, yes, science and technology are important, but they shouldn't overshadow the human element of healthcare.
Exactly. Robles makes this crucial point about the limitations of evidence-based practice. He argues that while scientific research is essential, it often fails to capture the nuances of individual experience, especially when it comes to something as subjective as pain.
So it's not about abandoning scientific evidence, but rather about recognizing that it doesn't tell the whole story. There's this whole other dimension of the human experience.
He uses the term intangible to describe these aspects of our lives, our feelings, beliefs, values, personal histories that often get overlooked in the rush to diagnose and treat. And it's these intangibles that really shape how we experience the world, including how we experience pain.
And it's those intangibles that you really start to uncover during those Kairos moments.
Precisely.
When you're truly present with the patient, listening not just to their words, but to the unspoken messages they're conveying.
It's in those moments that the care professional can begin to understand the patient's unique context and personalize their care accordingly.
Robles also talks about how our culture tends to prioritize what he calls ponderable knowledge over imponderable knowledge. In other words, we value what can be measured and quantified over that kind of messy, subjective world of feelings and personal experiences.
And that bias, Robles argues, has seeped into our healthcare system, making it difficult to address the complexities of chronic pain effectively. Because chronic pain isn't just a physical problem, it's an emotional, psychological,
and social problem as well.
Which brings us to his concept of axis 2. The emotional, behavioral, and psychosocial factors that contribute to the overall experience of chronic pain.
It's a brilliant way of framing it because it acknowledges that pain exists on a spectrum, that it's influenced by this complex interplay of factors that extend far beyond the purely physical.
So instead of just asking, where does it hurt? The care professional also needs to be asking, how is this pain affecting your life, your mood, your relationships, your sense of self?
Exactly.
And to illustrate the importance of axis 2, Robles points out that people with chronic pain often experience higher rates of anxiety, depression, and other mental health challenges.
Exactly. It's like a feedback loop. The pain triggers these negative thoughts and emotions, which then intensify the pain and so on. So addressing those axis 2 factors becomes essential for effective pain management.
And Robles talks about specific tools that care professionals can use to assess those factors.
Like the hospital anxiety and depression scale and the pain catastrophizing scale.
Those are just 2 examples of standardized assessments that can help paint a more comprehensive picture of the patient's experience, going beyond just the physical symptoms.
And then to address those axis 2 issues, he talks about the value of cognitive behavioral therapy, or CBT.
Yes, CBT is a fantastic tool for helping patients with chronic pain. because it focuses on this interconnectedness of thoughts, feelings, and behaviors.
Yeah.
It provides practical strategies for
Yeah.
managing pain, reducing stress, and improving coping skills.
It's like giving the patient a toolbox
Yeah.
full of techniques they can use
Exactly.
to navigate the emotional and psychological challenges
Yeah.
of living with chronic pain.
Exactly. And this is where that idea of empowerment comes in that we touched on earlier.
Right.
When patients understand their condition, their treatment options, and the various factors that contribute to their pain, they feel more in control of their situation.
So it's not about the care professional fixing the patient. It's about empowering the patient,
Exactly.
taking an active role in their own healing process.
That's the beauty of CBT. It encourages patients to become active participants in their care, rather than passive recipients of treatment.
Robles is really advocating for a more collaborative approach to healthcare, isn't he?
Yes.
One where the patient and the care professional work together as partners, each bringing their unique knowledge and expertise to the table.
Yes. And he doesn't shy away from acknowledging this inherent power imbalance that exists in the patient-caregiver relationship.
It's interesting because we often think of doctors and other care providers as being in a position of power. But it's easy to forget that patients are often in a very vulnerable state.
They are. They're often experiencing pain, fear, uncertainty, and they're relying on that care professional for guidance and support.
So how does Robles suggest navigating that power dynamic? How do you create a truly collaborative relationship when one person is inherently in a more vulnerable position?
He emphasizes the importance of open and honest communication, ensuring that the patient feels heard, respected, and empowered to participate in their own care.
It's about recognizing that the patient is the expert on their own experience.
Exactly.
Even if they don't have a medical degree.
And that means shifting from a model of doctor knows best to a model of shared decision-making, where the patient's preferences and values are central to the care plan.
And that requires a lot of trust, doesn't it?
Yeah.
The patient needs to trust the care professional.
It does.
To listen to them, to respect their autonomy, and to advocate for their best interests. And the care professional needs to trust the patient to be honest about their experiences and to actively participate in their own healing.
It's a two-way street. He uses this beautiful analogy to describe this relationship. He compares it to a dance.
I love that because a dance requires both partners to be in sync, to be responsive to each other's movements, to create something harmonious and beautiful.
Exactly. And just like in a dance, there will be times when one partner leads and the other follows. But there's always this sense of connection.
The mutual respect.
But even the best dancers stumble sometimes, right? So what happens when that trust is broken? Or when there's a miscommunication? Or a disagreement between the patient and the care professional?
Robles acknowledges that these challenges are inevitable. There will be times when personalities clash, when communication breaks down, or when patients make choices that the care professional might disagree with.
And in those situations, it's easy for the care professional to fall back into that expert role and try to control the situation. But that's not what Robles is advocating for, is it?
Not at all. He stresses the importance of approaching those challenges with compassion and understanding, recognizing that both the patient and the care professional are human beings, each with their own unique set of strengths, weaknesses, and vulnerabilities.
It's about remembering that even in the midst of disagreement or frustration, the goal is to maintain that connection, to keep that dance going. And sometimes that might mean acknowledging that the care professional isn't the best fit for a particular patient and being willing to refer them to someone who might be better suited to their needs. It's about putting the patient's well-being above all else.
It's a humbling reminder that we're all human, that we all make mistakes, and that sometimes the most compassionate thing you can do is admit you don't have all the answers and seek guidance from others.
It's about letting go of the ego and focusing on what truly serves the patient.
So it sounds like Robles is advocating for a radical shift in the way we think about healthcare, moving away from this model of the all-knowing doctor and toward a more collaborative, patient-centered approach that emphasizes empathy, compassion, and the importance of the human connection.
That's a beautiful way to put it. He's essentially calling for a healthcare system that recognizes the whole person, their physical symptoms, their emotional struggles, their social context, their values, their beliefs, and treats them with dignity, respect, and compassion.
And a big part of that, it seems, is about empowering patients to become active participants in their own healing process.
Absolutely. It's about giving them the tools and the knowledge they need to navigate the complexities of their condition and to make informed decisions about their care.
Riley's work really challenges us to think differently.
Yeah.
About the role of the care professional, doesn't it?
It does. Yeah.
It's no just about diagnosing and treating diseases. It's about accompanying patients on their journey toward a more balanced and fulfilling life.
It's a profound shift in perspective, and it has the potential to transform the way healthcare is delivered and experienced.
It feels like Robles is advocating for a complete paradigm shift.
Yeah.
Not just in the way healthcare is delivered, but in the way we as a society view health and well-being in general.
Yeah, he's definitely challenging some deeply ingrained assumptions. One of the things that struck me most about his work is his emphasis on the importance of self-awareness for care professionals.
He's not just talking about being aware of your medical knowledge and skills, right?
Right. He's talking about something much deeper.
Okay.
He's talking about understanding your own emotional responses, your biases, your triggers, your limitations. Because if you're not aware of those things, you risk projecting them onto your patients.
Right.
Or letting them cloud your judgment.
It makes me think of that saying, physician, heal thyself.
Yeah, exactly.
Before you can truly care for others, you need to take care of yourself, understand your own inner landscape.
Robles talks about the need for care professionals to engage in regular self-reflection, to really examine their motivations, their values, and their beliefs about health and healing.
Because ultimately, those beliefs will shape the way they interact with their patients.
Absolutely.
Whether they're conscious of it or not.
And it's not just about self-awareness. It's also about humility.
Humility.
Yeah.
In the medical field.
Yeah.
It seems like we're often conditioned to believe that. Doctors have all the answers.
Yeah.
That they're the experts.
Yeah.
The authority figures.
Yeah. Robles really challenges that notion. He argues that true humility is essential for effective caregiving, especially when dealing with complex conditions like chronic pain.
So what does humility look like in practice?
It's about being willing to admit when you don't know something, being open to learning from your patients, and recognizing that you don't have to have all the answers to be a good caregiver.
It's about letting go of that hero complex, that need to single-handedly solve all the patient's problems.
Right, because sometimes the most compassionate thing you can do is acknowledge your limitations.
Right.
And refer the patient to another specialist or seek guidance from colleagues.
It's about recognizing that healthcare is a team effort.
Exactly.
That no one person has all the knowledge or skills needed to address the complexities of human suffering.
And that humility, Robles argues, is crucial for preventing burnout and maintaining a sustainable practice.
It's like he's saying that by embracing our own limitations, we actually create more space for healing to occur, both for ourselves and for our patients.
It's a beautiful paradox.
It ties in so well with all the other ideas we've been discussing. The importance of compassion, the power of the human connection, the need for a more collaborative approach to healthcare.
Robles' work really challenges us to rethink the very foundations of our healthcare system. It's a call to action, not just for care professionals, but for all of us.
And he leaves us with a really powerful question.
He does, yeah.
Something to ponder as we move forward.
What does it mean to be truly human in the face of suffering, both our own and that of others?
And how can we cultivate the compassion and wisdom needed to provide genuine care, both for ourselves and for the people around us?
Those are questions worth reflecting on, regardless of your role in the healthcare system.
Because we're all patients at some point in our lives.
Exactly.
Well, we hope this deep dive into Dr. Robles' work has given you some food for thought and perhaps even inspired you to take a more active role in shaping a healthcare system that prioritizes compassion, connection, and the well-being of the whole person. Thanks for joining us. And we'll see you next time on The Deep Dive